They're fighting COVID-19 and working to keep Hoosiers healthy. And tonight, Central Indiana's biggest healthcare systems are also taking steps to eliminate racism as a public health crisis.
And the leaders of Eskenazi Health, Community Health Network, and Indiana University Health have signed off on a pledge to promote healthcare equity in all the communities they serve. This is the next step after doctors, nurses, medical students, and other healthcare workers held a march over the summer in solidarity with racial justice protests. WRTV's Cornelius Hawker talked to a doctor who says this is a step in the right direction.
Dr. Ashley Meager was one of the hundreds of people who took part in the White Coats for Black Lives rally march in June. Medical professionals vowing to do their part to tear down systemic racism.
All of the systemic racism that's been built into the medical system for years, for decades, really affects our patients on a day-to-day basis, and it affects their lives.
That's why Dr. Meager is happy to hear 3 of Central Indiana's biggest healthcare systems pledge to address racism in healthcare.
It is crucial that health systems recognize and deliberately institute anti-racist policies to start breaking away at those decades of disparities.
To see the disparities in healthcare, you only need to look at the communities hardest hit by the pandemic. State health department data shows Black people make up a larger portion of COVID-19 deaths compared to a percentage of Indiana's population. So how does systemic racism play a role in this? African Americans tend to distrust doctors because of past unethical treatment. Think the Tuskegee study where African American men were lied to about getting treatment for syphilis. It lasted for 40 years. That, along with other issues like a lack of access to medical centers or affordable healthy food, has led to health problems like diabetes and high blood pressure. All things that increase the chances of dying from COVID-19, all things that can be traced back to systemic racism. So where do we go from here? That's the question I posed to Dr. Meager, and she says the change starts one patient at a time.
Physicians are on the forefront of kind of breaking down some of this and providing healthcare for a patient rather than a whole group of people as a kind of monolithic block.
Working for you, Cornelius Hawker, WRTV.
And included in the plan laid out by IU Health, Eskenazi Health, and Community Health Network is a commitment to finding ways to reduce healthcare disparities and to make sure their leadership teams reflect the demographics of the communities they serve. You can check out the full pledge and plan at WRTV.com.
Is progress being made when it comes to the relationship between IMPD and the community? Well, we took that question to 2 groups today, Faith in Indiana and Indy 10 Black Lives Matter. Both have been fighting for racial justice and reform for years, well before this summer's demonstrations and protests. Faith in Indiana supported the push to create a new IMPD General Orders Board that will be made up of 4 civilians and 3 law enforcement officers. Leaders with both organizations say that's a good step forward, but the entire system needs improvements.
What are the people of faith saying needs to be done? So we've done a work around police reform. We're also doing work around rehabilitation instead of incarceration, continuing to do work as it pertains to making sure that we are ensuring that gun reform is happening.
I think, of course, that there are community members who may be in support of policing or their understanding of what policing is, but it needs work. We understand that the police don't live in our communities, that they simply come into the communities to surveil, capture, and incarcerate. And so we are seeking reform in some instances, but ultimately an overall defunding and abolition of that entity.
We also reached out to IMPD Chief Randall Taylor. He released a statement saying, in part, quote, "Over the last several years, as this city has invested millions in community-based efforts to improve the health and safety of our neighborhoods, IMPD has remained focused on building bridges of trust and with residents and developing the kind of police neighborhood partnerships that reduced violence," end quote.
And as COVID-19 continues to make the school year a challenge, parents are getting creative to make sure their kids are still learning if they cannot be in the classroom. WRTV's Cameron Riddle shows us the resources available for families as this school year evolves.
My kids go to school every other day in person, and on the alternate days, they were at home, kind of goofing off.
Between the challenge of doing her own job and monitoring her kids' virtual schoolwork, Tiffany Tabb is taking advantage of extra help through community learning sites powered by the Mind Trust, which offers e-learning support, a safe place, and meals to all students in grades K through 12. Tabb says she gets why her daughters can only be in school part-time, but says keeping them at home 3 days a week is not ideal.
That's not what I want for them, and that's not really what's best for them. That's not ideal. They really need to be somewhere where there's some structure and where there's appropriate supervision.
Since mid-August, the Mind Trust has been running 15 learning sites across Indianapolis 5 days a week, with 325 students attending from just about every school district. Now, as more schools reopen their physical classrooms, 3 of those locations are extending their services until the end of the semester. You'll find Pam Leeper at the Reset Center location on the east side. She says parents are eager to sign their kids up.
It's just too stressful to, again, if they're at home or if they have to leave the kids at home. Either way, it just concerns them.
The learning site locations are strategically mapped across the city, with Christa Morehouse serving the west side, the Shepherd Community Center on the near east side, and the Reset Center on the far east side. The e-learning support, meals, and supervision are all 100% free. Patrick Jones with the Mind Trust says this is their way of supporting families in a difficult year.
You still don't feel comfortable and safe to send your kids to school. You can send them in a safe and sterilized place where they can come and learn and get cared for in a place that you can feel comfortable with.
Cameron Riddle, WRTV.
And the learning sites are able to continue thanks to $88,000 of investment from the city and the Mind Trust. The organization says they now have the space to serve 100 students in socially distanced settings.
New COVID-19 cases and the percentage of positive cases in Indiana continue to trend in the wrong direction. According to the State Department,